We've been working with the team at Good Samaritan Regional Medical Center to develop a total joint program that really helps streamline the process of undergoing a joint replacement for patients.
We have put together a rather unique program. We have an integrated approach where the primary physician is in contact with the orthopedic surgeon. We are all in direct communication with the hospital.
We've been working with the physical therapists and the nurses and the operating room staff. We've been working with the floor nurses. The whole hospital is coming together as a team.
And basically what it is you want everything to be streamlined and everyone to be on the same page in terms of what our goals are, not only from the surgery and the recovery in the hospital, but well before the surgery with joint courses that are given.
The team approach is really essential for a total joint program. It makes the whole process much smoother.
Large advantage of the total joint program in Rockland County is this is a local program served by local physicians, local nurses. You are able to get that warm, one-on-one approach that you're used to with a community hospital rather than a large academic center where you can lose that personal touch.
We here in Rockland County haven't had the advantage of a team approach until recently. So while I've been performing these joint replacements, I've seen all the different parts start to come together, and that's what's happening here.
The length of stay decreases, the anesthesia is on board and comfortable with the different techniques to try to minimize pain, and the rehab facilities are eager to get these patients moving. And
by having care in Rockland County, the families can visit patients in the hospital. It's so much easier than having surgery in New York City. In addition, your own doctor is here at the hospital to look after you. Whereas if somebody goes into New York City, all the doctors have to learn who you are when you're there. So it's a much more unified experience here.
And it starts from the very beginning, from their primary care physician who manages them to make sure they're in optimal medical condition if they do require surgery, to the treatment they receive here in the office.
X-rays are obtained here in the office so we can further evaluate their problem and confirm whether or not there is arthritis and to what degree there's arthritis. And the important thing for patients to know is that the majority of what we treat is treated non-surgically. We're orthopedic surgeons, but that does not mean if you come to see us that you're going to have surgery.
But when conservative measures fail, joint replacement provides a wonderful option for these patients.
I think a very important part of joint replacement surgery is that this is the last step.
We try non-surgical means first, non-invasive means of treatment. If those means fail, then a total joint replacement may be necessary to alleviate symptoms. And it's at that point we have a thorough discussion about what a total joint replacement is.
And it is something that the patient needs to come to you and say, you know what, I'm ready for this operation. And when they are, I think it's a great operation to have. And most people afterwards say, I wish I had done it sooner.
So when we do the total joint replacement, it's a big decision for a patient. So it's very important to work as a team, both for the best interest of the patient, as well as me as a surgeon to get the best outcome out of each and every patient.
But it's very important to understand what every patient expects about their recovery. And so every patient, of course, has individual needs, and we need to direct their treatment and tailor it to that end.
I make sure that I have a long discussion with the patient to understand their history, their complaints, exactly what's bothering them.
As well as to then examine the patient thoroughly and then finally review any x-rays, any previous treatment they have had, and any laboratory results. Sometimes we need to do additional x-rays or testing or other consultations.
And then I perform a thorough physical examination to really pinpoint where their pain is coming from.
So that also helps for quicker recovery, better pain control, and also minimizes the risk of dislocation following the surgery.
We're doing everything we can to take the intimidation out of the process for patients and make them understand every facet, every aspect of the process.
Also, we have a more efficient system for getting people out of the hospital so they don't stay here for a week when they could be out of the hospital in 3 or 4 days. And the planning for discharge is as important as the actual surgery when it comes to the experience around the time of joint replacement.
We have got a special team in the hospital both for the surgical team as well as the rehabilitation team. So in that way, with the team approach involving both the surgical, non-surgical team, the anesthesia, we put every one of them on the same boat.
So it's helped the patient a lot to get through this operation easier. It's a big undertaking for the patient, and with the team approach, with the nurses that are specialized and the social workers that are specialized, it's been a great improvement for the patient.
I think with my excellent surgical and rehabilitation team, we work as a team and we ensure that the patient get the best possible outcome at the end of the day.
Any joint in the body can be replaced, and essentially the arthritis can be cured. So it's possible to completely alleviate patients of their pain and get them back to functioning in their normal daily lives.